like to invite everyone that has spoken as a sort of panel discussions. And please, audience, do share your questions or any comments you'd like to make. And one of the questions that I have, first of all, is we need more RNs in aged care. We know that. So panel members, how do we attract more RNs, including students, to aged care as a profession, as a career pathway? Sorry. Anyone want to unmute, or shall I ask someone first? Kira, I can start with you.
Well, I think, Helen, that's a very good question, because I think we're running out of nurses. I think that the stats saying that our workforce is aging, we're not really attracting it because aged care is not sexy, unfortunately. I think we need to have a clear pathway, a career pathway that is that will inspire people to actually spend their years coming in here. I think when like I think the comment earlier of like you go to aged care because you're retiring, that's still rampant. Everyone thinks, especially the new grads, are thinking that no, I don't want to go to aged care. I want to explore the world, and then when I'm ready to retire, I go to aged care. But because they don't see the clear pathway, that there's actually, it's not just management. They're just not gonna stay there as an RN forever. There's actually other ways to advance your career in aged care. And I think another thing would be really looking at remuneration. I know we in aged care, unfortunately, as blunt as it sounds like, but most of the time we run on compassion mill. So we rely on compassion of our workers to actually give extra or be happy with the current remuneration. So I think that's why we're not attracting people, because it's not just there's some way to actually fulfill that your passion, your love for aged care, but also you need to be remunerated so you stay and progress in this field.
Thank you. Anyone else wanted to make a comment before we move to another question?
Yeah, I just agree with Kira that we need a proper pathway. So it's so easy if you're an RN and you're a grad and then you decide you want to do emergency nursing. There's a clear guideline of the postgrad studies that you do, and this is where you end. And I think mostly because that's acute sector, and it's been, the guidelines are there standardized, whereas majority of aged care providers are private, so everybody is doing their own thing, which then makes it difficult for young RNs coming in to actually know that if I'm going to work for this provider, they will actually have a proper pathway for me, so I can actually even look at my own progression as a nurse, and say, right, I've moved on from this level to CNS to CNC. Those are titles that don't exist in private aged care. Or more in some might have them, but most don't. So that clear career progression doesn't exist, and so everybody wants to know that they're a better version of themselves today than they were yesterday. And if there's nothing there for you to show for it, then you always then end up feeling just lost, and that's why they end up going into the acute sector, because that pathway is there and it's on paper. You can't skip, you can't change it.
Thanks, Prosper. Now, a question that we've got from someone in the audience, Yumi, has spoken about, first of all, wanted to appreciate all the fabulous nurses working in aged care, and wanted really to comment on the perspectives on the scale of the different types of abuse that are taking place in aged care, but not just abuse to residents, but also abuse that staff receive. And want to know, what can we do better to encourage providers to take this matter seriously, to keep staff and residents safe? Shoshana, can I direct to you?
Sorry, this is Dana. Yeah, I want to comment on that. With the Royal Commission in Aged Care, there has been a lot of changes in the reporting and incident management process, which is a great thing. Like with the introduction of serious incidents risk scheme in aged care, it has outlined there are two categories. One, that you have to report within 24 hours, and there is another one which you have to report within 30 days time frame. So there are 8 categories of the incident that are reportable to the commission, one of them being the abuse, elder abuse. So it has actually made a really in compared to like a few years ago, since the source introduction, that it has become open that, you know, once there is an incident, the nurses and the home report it and it's submit the report to the commission, and aged care commission reviews those incidents that's occurring in the aged care home, and there is an ongoing issue with the same thing. Obviously aged care commission stepped in and review the home, how they are managing those incidents. So I think this is one of the great steps forward into the aged care through the Royal Commission with the introduction of SOURCE, and we have made the aged care provider with the, you know, greater training and the resource for the registered nurse and the manager to act on those, because after all, you know, it's about safety and the quality of this aging population that we look after. So one of the greatest things that I say is like, and also the staff training, if you are seeing those abuse or abnormal activities on the floor, and the confidence that you embed in your team that you need to report. When you report, the things gets investigated and we can have the plan in place to manage those incidents. So I think introduction of the source in the aged care as well as in a home care setting is a great step forward, and there is more it can be done, but but at the moment having that one is also one stepping stone ahead.
Thank you, Shujana, for that response. A question that another question that we have is, what do you think the impact of, you know, we've got this the new Aged Care Act that's coming. What do you really think the impact of that act would be for both residents and staff?
With the new reforms in aged care, yes, we still waiting for some of the bills to pass, but I think it's a positive outcome for the sector. But there is always, you know, the drawbacks or disadvantage, but also it comes with so many advantages. So with the new aged care reforms, there has been change in the staffing level. So 24/7 registered nurse and the care minutes has increased, and which is again increasing in July 2024, and making it mandated. The other thing is these reforms had made that improve in quality of care, and the reporting guidelines, and the more as aged care we report to the Commission and Department of Health, and there are other quality indicators in aged care that gets reported, like weight loss, hospitalization, frequent hospitalization, pressure injuries, falls, and activity of daily livings, incontinence. You know, those data have been presented into the Department of Health, and it's open now. You know, everyone can see like how home is doing, and that has actually given home to work better and be better, you know, if you are. And also the aged care star, the government also has introduced the star rating system into the aged care. So, you know, like 3-star, 4-star, 5-star. So, you know, like you strive for better. So if you are 3 as an aged care provider, as a manager, I strive and look for it what I am lacking, and look forward to, you know, make my progress to make the better aged care provider that I provide care to our residents. So it actually allows as an aged care provider to strive for better. So those reforms, and also it does come with the, you know, the in remote area of maybe Australia, there may not be the enough registered nurse, or in some part of like even Australia may not have enough registered nurse that are attracted in the gerontological nursing, but you know, the platform like GANA and doing this webinar, and we speaking that proudly how what we do today, and to make the difference in the life of our residents, I think would be inspiring to many, and the platform like this should, you know, advocate for our elderly residents and our gerontological nurses to attract more nurses to wanting to work for aged care, you know. So aged care, like to me, it's a beautiful place, you know. This is where my brain and I live here, you know, like more like rather than my families, I'm actually spending more time with my residents, and the bonding that I create, you know, and And the thought that I walk out of the door is about residents. Are they safe? Have I done enough to make sure to leave it for the overnight? I think about them, and they are my inspiration for me to work harder and smarter and do best for them. So yeah, and also I think
Thanks so much. Thanks so much for that answer. I'm just going to move on to a next question that I can see, so I'm mindful of the time. Could the panel please share their thoughts on mentorship, working with and guiding new RNs starting out? How can new RNs learn if they do not have anyone to learn from on a day-to-day basis? Kira, can I get your comments on that?
Absolutely correct. I think that's still an issue. Even as a nurse practitioner, it was really a struggle to find another nurse practitioner to mentor you. It's good if you have that GP who will mentor you, but they're not nurse practitioners. They're not nurses. So they can't really teach you. They can teach you how to be a doctor, but they cannot teach you how to be a nurse practitioner. And I think that's similar to nurses in aged care. There's a big turnaround with nurses, because nurses don't want to stay in aged care anymore. So we're losing a lot of our senior nurses. Either they're retiring or going to different field. They're going to management, and their titles are getting changed. They're no longer registered nurse. They're they're managers. But I think that the beauty of actually having someone to look up to, a senior nurse to look up to, that unfortunately I'm worried that that's getting lost. I think the way to look at that is really our organizations making a strong voice to actually empower the nurses, and giving that ownership and leadership back in aged care for the nurses. Because I think I'm biased because I'm a nurse, but we are able to actually provide a very holistic approach to things. And if we are providing even roles that are in the management, if you have a nurse in that leadership role, they are able to actually look at the whole picture for that patient, not just for the patient, and for their loved ones as well, and more able to advocate for everyone in their under their wing.
Thank you very much, Kira. And another question that's come through, and actually it's actually from Cassia, and Prosper, I'll actually direct this one to you. It's not a question, but a comment from Cassia. Can I encourage all managers that are nurses, so this is you as well, Srijana, to keep RNs in their titles, please? Sometimes the nurses become invisible as they progress, which is a pity. What's your comment on that, Prosper?
Yeah, I think it's actually true. It's actually I always like when I walk into a home and there's a manager, and I know I'm biased, and it's probably not a good thing. I always want to know, are they an RN? Because I always expect a different type of empathy and attitude from them, because they are a nurse. Whereas if I walk into a home and the manager is non-clinical, it's always that thing at the back of my mind of leaving that room to say, okay, So yes, you're right. It's always good to walk in and know that they're an RN, it's a fellow RN, and that they will have that same compassion, but also that the junior RNs can then feel that they can actually go and approach that person, because I think it becomes that issue of, well, they're my boss, so can I actually go to them and say, I just need some time to understand why I've got to do this blood pressure on Jane, because no one's really explaining to me. And that's where I think, knowing that your boss is an RN, my boss was an RN, and she really empowered me. So yes, she would wear the manager hat, but every time I needed something clinical, some clinical mentorship, she was always there for me in that angle as an RN. So she'd take off her managerial hat, and she'd always say to me, I'm taking off the managerial hat today, and you and I are just talking RN to RN. And that was really good to then get that kind of mentorship happening. And I do the same now. If I'm mentoring someone, I'll always say to them, because sometimes it's easy also when you're an NP for a junior RN to see you as if you're so far away from them. And therefore, if I ask a question, is it going to be too silly to ask? And so it's always then good to say, actually, I am a nurse. I'm a registered nurse. first and foremost. So whatever you've gone through, I've gone through as well. So feel free to reach out and ask. There's nothing silly.
Thank you, Prosper. Got a comment here from Emma Metcalf. It's based on the comment we had earlier about the mentors. And she said the ACNP, which is the Australian College of Nurse Practitioners, handles requests for mentors across disciplines. And Emma said that she's currently mentoring 2 nurse practitioner aged care candidates in WA. So thanks for doing that, Emma. Well done. Now, another question that I have is, what do you see as the impact of RNs in aged care, including with the care minutes, etc., and relating that to cost effectiveness? I know at the in the beginning when Castro was speaking, she talked about there's a lot of there's research that's on evidence to look at the impact of registered nurses working in the acute setting. There's limited, if any, research that were translating into residential aged care, the aged care space. What do you see, and I'll ask Oliver, Srijana, probably start with yourself, but just briefly, what do you see as the impact of RNs in aged care?
The impact of 24/7 registered nurse in aged care will definitely improve the quality of care our residents, and also early detection of the problem and intervention in a timely manner that would reduce the unnecessary hospitalization, which is one of the most important thing that we see as a having 24/7 aged care nurse. We can timely meet those needs. And also it may be a problem in other parts of Australia, as I say, I think the government has to do more in getting more registered nurses maybe from overseas if we do not have in Australia, and give them an easier pathway to become a registered nurse. So that may be the other alternatives to get the registered nurses working in aged care. And the other point will be, again, advocating about the aged care nurses through the platform like GANA. The other thing, again, which comes with 24/7 registered nurse will be definitely, the quality compliance, making early assessment and detection of the problem, promoting the health of a resident. All that come as a, the positive impact overall. But there is more it can be done in order to help the aged care sector throughout Australia.
Well, thank you so much, Srijana. And I think we're sort of running low on time, and I really wanted to thank our panel members today for speaking. Srijana Gautam, Kira Kim, Prosper Banford, and also Kevin Jones. Really appreciate your discussions.